Hi, everybody. I'm Kristen Levine, and today we're talking about a serious problem that can really affect our cat's quality of life, and that is feline osteoarthritis, or OA pain. Now, OA pain affects nearly 40% of cats, and in clinical studies, OA was detected in 60% of cats older than 6 years of age and 90% of cats older than 12 years of age, so it's pretty common. It can cause really horrible pain for our feline friends. And unfortunately, for us as pet parents, we might not be able to easily tell if our cats have OA pain. But thankfully, I have Dr. Brian Neumann as my guest today. Dr. Neumann is a partner and medical director at Caring Hands Animal Hospital of Alexandria, that's in Virginia. And he's going to tell us more about the disease, signs that your cat might have OA pain, and ways to manage your cat's pain. Now, we're also going to give you a simple tool that can be used to screen for OA pain at home, because that's where cats feel safe enough to actually show their pain. And further, we're going to discuss the first FDA-approved therapeutic to control OA pain, which is called Solensia, or Frunevetmab injection. Now, it's already helped many cats improve their quality of life, and pet parents are even saying, "I have my cat back." So with that, Dr. Neumann, thank you so much for being here today.
Thank you, Kristen. It's really great to be here. I'm really fortunate to be in a position where I can provide the best care possible for our animals and enhance their lives with their owners. So anytime there's something like this on the horizon that can help me provide that optimal care, I get really jazzed up and really excited. So thank you very much.
Absolutely. So before we get into the details of treatment and things like that, I want to make sure everybody's on the same page. So Dr. Neumann, can you tell us exactly what is feline OA pain?
No, great question. And the most important part about OA and OA pain is that this is a degenerative condition. That's a hard thing to hear, but it's really important that this is something that we manage and we mitigate. This is not something that we can cure or reverse. And so a lot of people will associate degenerative with an older cat disease. This is actually something we can also see in our younger cats. So as we talk about these signs and what to look for, this is not just for our older cats. This is for every cat that we have, regardless of their age. So what happens in osteoarthritis and osteoarthritis pain, cartilage within the joints will gradually break down over time. This can be triggered by previous injuries or anatomic abnormalities within these cat joints. And over time, this breakdown, it causes decreased mobility, increased pain, and this can rapidly decrease the quality of life and the life enhancement of the cat. And what makes OA and OA pain really difficult in cats is they can mask this pain so well. But as I'll mention, we'll find some things that we can look for certain behaviors, and we can make these more recognizable for the pet parent.
Well, with cats being so good at masking pain, it's really sad to think of them suffering like that. So, Doc, what is causing the pain exactly?
Yeah, so if you're thinking about it, what makes a joint? Two bones are coming together, and these bones, if they're lined with nerves, and if these bones were to rub up against each other directly over time, they would continue rubbing and grinding, and that would be incredibly painful and incredibly irritating. So this is why we have cartilage covering those bony surfaces, and it's a soft tissue that essentially serves as a cushion, and it prevents that bone-on-bone contact, and it serves almost like a buffer. So if that cartilage is damaged, such as maybe from an injury, let's think about when you sprain your wrist or you sprain your ankle, and think of all of that swelling and all of that inflammation that we have, that starts setting off a really vicious cycle. So you have damage to the cartilage and that subsequent inflammation from that. This damages cells within the cartilage. That then triggers other cells to come and help with that damage and provide more inflammation. And this creates more cartilage damage and more pain. So it creates this nasty domino effect. And if that goes untreated, then we enter into this chronic pain phase, which that in and of itself is a huge problem and tough to deal with. So if I'm going to nerd out for a minute and talk science, there's this protein that's called nerve growth factor. And this has been shown to be incredibly elevated in joints that are affected with osteoarthritis and can actually negatively contribute to that chronic pain cycle. Now, appropriate levels, healthy levels of NGF are really important in developing animals and the development of their nervous system. But when this is in excess in the body, this can cause pain and this has caused discomfort. And there have been levels of NGF elevated in joints affected by osteoarthritis.
So obviously this sounds like a really serious condition, but how common is OA really, Doc?
It's a great question. So, clinical studies have actually shown what's really scary. Actually, two-thirds, just almost two-thirds, 61% of animals over the age of 6 and 90% of cats over the age of 12 actually have signs of osteoarthritis. And what's scary is that 40% of those actually showed signs of pain.
Mm.
And we know that no pet parent wants to see their pet in pain. And so while osteoarthritis can be really difficult to recognize, when they understand how common it is and what to look for, they're way more motivated to help bring their cat into the vet and actually help control and diagnose and treat this condition.
Right, absolutely. That's why we're here today. So what exactly are some of the things that we as pet parents can be on the lookout for?
And that's one of the most important questions that I get asked every day. And the oversimplification is that we want to be on the lookout for anything that is different or unusual with our cat's behavior. You know your cat best. And sometimes the my cat just isn't acting him or herself is one of the most important signs right there. But there are a lot of signs that are incredibly subtle, but some of the ones that I look for, one of the biggest ones is your cat running less. Did they used to play with toys or play with laser pointers or get the zoomies, and all of a sudden those behaviors have changed? They're more sedentary, they're hiding more. That's a huge one that brings cats into me to evaluate this. Have they stopped jumping on their favorite perches? That's another big one. The couch, the window perch. Or do they go over to jump onto that perch, and do they hesitate and walk away? Or do they try to jump and they miss their mark? Very, very common. Another one that I alert my pet parents to look for is going up and down the stairs. Do they normally swiftly go up and down the stairs in a straight line with their tail up? Or are they pausing in between or hesitating or stopping afterwards because they're so tired? Very, very common. And another one that's kind of an outside the box thing to look for is just the overall appearance of your cat. Do they have an unkempt hair coat? Are they poorly groomed? That could be a telltale sign of pain that's uncontrolled in the cat.
Yeah, and those all make a lot of sense. But what if your cat is just less energetic or showing less enthusiasm?
We definitely pay attention to this as well. If you have a cat that was a big part of the family and was very interactive with the humans in the house, with other cats, with other animals, but now all of a sudden they're hiding, they're not coming out to greet you, that's a huge thing that we look for. Another thing that I've seen in a lot of my OA pain cats is increase in aggression towards people, towards visitors, towards their housemates. That is something that has been the primary complaint that I've seen. And another one that a lot of pet parents don't think about is litter box issues. Are they all of a sudden going pee or poop outside of the litter box, right next to the litter box? A lot of people write this off to them either having some anxiety or being vindictive, but actually, are they having trouble getting into the litter box? That's a big one to look for. And these signs, they're so easy to miss. And they're so easy to attribute to, oh, he's just a jerk or she's just getting old. And you can't treat old age, but you certainly can manage and mitigate pain associated with osteoarthritis that's causing a lot of these conditions. And once we actually have these conversations with the pet owners and we start the treatment, owners are shocked that they're getting a lot of their cats back to their old selves, which is great.
Oh, that must be a great feeling.
It is. It is.
So what does a veterinarian like yourself do exactly to diagnose OA and OA pain in cats?
No, very good question. And the first and the most important thing that I do as a veterinarian is I take a very thorough history. We start asking questions about any previous injuries related to the cat, dietary changes, any previous trauma. We start high level, and then I start asking, I call it 20 questions, pinpointed questions about a lot of those behaviors that we're talking about associated with arthritis. Are they running less? Are they having trouble going up the stairs? Because sometimes owners need to actually reflect and notice that's what's going on with their cat. One thing that really helps that I arm a lot of my owners with is having them either keep a journal or even better, a video log. So you can actually see what your cat is doing. And that helps me track that behavior, which is really cool. And another thing that I'll actually do in my practice is I'll refer all of my pet parents and even a lot of my colleagues to a catoachecklist.com. And this is where you can actually find an at-home osteoarthritis pain checklist. And this is great. This serves as a barometer and as almost a litmus test to see, are your cats doing any of these red flag behaviors that maybe might want to prompt you to bringing them into the vet and having them looked at and actually addressing this issue. And then after we have that history, we have that conversation. A lot of vets, and I do this too, I'll take x-rays, making sure there hasn't been a previous injury or any other structural abnormality that could be causing these issues. I'll run some blood work to see if they're safe for any medical intervention or if there are any other previous medical problems that could be contributing as well. All that being said, the most important part of my diagnosis and deciding that this cat has osteoarthritis is that history, and it is those behavior changes that we're seeing. And so once we reach that diagnosis, it's time to form a treatment plan. And in the past, that used to be oral medications. Oftentimes it was anti-inflammatory medications. And with the thought of, well, arthritis is an inflammatory condition. I was talking about all that inflammation before. If we treat the inflammation, we're going to treat the pain and the cat's going to be more comfortable, which I had mixed results with. And what's beautiful now is, as you mentioned before, there's this really exciting new cat-specific option that's called Solensia, or Frunevetmab injection. And this is made by Zoetis. And this, for me, has changed the game in terms of how we can help so many more cats that, in my opinion, we haven't been able to help before. And this is really cool because this is the first and only FDA-approved drug for the management of arthritis pain for cats specifically, which is just incredible.
I can hear the enthusiasm in your voice. You know, it's great to have a new tool to help Absolutely. Your cat patients. Mm-hmm. So I'm guessing when you mentioned earlier things that vets have that can make a huge difference for our cats, you were talking about Solensia. So tell us, what does it do? And what I mean by that is, it sounds like it's not another pain medication. So how is Solensia helping with OA pain?
No, great question. And if you remember, I had mentioned earlier, I was talking about nerve growth factor, or NGF, that is in high levels in the joints of animals that have osteoarthritis that can be causing that chronic pain. And the goal is we're trying to make them less painful by reducing and removing as much of that extra NGF that we can. So Zoetis created this. It's called a monoclonal antibody that could be specific, that is specifically for cats. And what this does is, once we give this injection, you can think of Solensia almost as like a sponge within the joint, soaking up all of that extra NGF, or as much of that extra NGF as possible, and getting rid of it, and thus reducing pain and increasing quality of life. And it's a once-a-month injection, which is great because we do that at the vet clinic. Because I don't know about you, but giving oral medications to cats is not fun for anybody involved. The cat is stressed, the owner is stressed. Oftentimes the cat and or the owner is wearing the medication than actually getting the medication. And so being able to take that stress off of the owner and actually provide a reliable treatment option that we're giving in the clinic has really changed the game for us. And it's a much more sustainable setup for so many more pet owners. Like I said, I used oral anti-inflammatories. I would use pain medications like gabapentin with very mixed and inconsistent results. And now that I've been able to use this, the results have been astonishing. I mean, I have owners 2 and 3 and 4 injections in coming in and telling me my cat got his purr back, or my favorite was a client coming in tears saying, my cat has the zoomies again. The zoomies exist again, Dr. Neumann, which is just, brings tears to my eyes. It was wonderful. And so this is why I'm telling anyone, if any of your cats are having any of these red flag behaviors that we talked about, or you go to that checklist and you're seeing any of those behaviors, make an appointment with your veterinarian and start being able to get to the root of this and start treating it as soon as possible.
Yeah, absolutely. We definitely want to see those zoomies come back, because nothing tells us that our cats are feeling great like the zoomies, right?
Exactly.
So, you're talking about how important it is to get this diagnosis quickly. Tell us, what happens if you don't treat OA?
Well, as I said in the very beginning, this is degenerative. And so without any treatment, this is just going to progress, and this is just going to get worse. And there's going to be more of that nerve growth factor and more of that inflammation and discomfort. And this could have detrimental effects on mobility, on well-being, and ultimately on the human-animal bond that I have taken an oath to protect. So if we don't treat this sooner, these cats are going to be painful for their golden years, which we do not want. Nobody wants to see their pet suffer from chronic pain. And that's exactly what can happen if we don't at least attempt to mitigate and manage this as best as possible and as soon as possible.
Yeah, it's so so good to know, so comforting to know that we as pet parents have a way to help our cats control that OA pain with this first of its kind treatment. Now,
Mhm.
let's say that you've taken your cat to the vet and they've told you that your cat has OA and you started that treatment. How as a pet parent do I know that my cat isn't in pain anymore?
No, that's a great question. And I get asked that before we even start this treatment a lot
Yeah.
of times. And I tell all of my pet parents the language of pain in cats is behavior. So as your cat starts to become more comfortable, starts to have less pain, improved mobility, you're going to see those behaviors that they were doing once before improved again. This is one reason why we'll take those videos. You'll see them going up the stairs more. They'll be happy back in their perch. They'll be interacting with you, maybe getting those zoomies again. All of those things you will actually see improved on a daily and monthly basis to show that Solensia is actually really working. So when we break that cycle of pain, we're taking years back that we've seen these cats lose a lot of that quality of life and some of the things that they do that they really love. They're getting their cat back. And so hearing these success stories and seeing these behaviors change, it gives me so much joy and gratification, because literally this is helping me do what I am supposed to do, providing the best care to make these cats as happy and healthy as possible and enhance the bond that they have with their people that love them so much. And that's the fact that I'm able to do this with this extra tool in the toolbox has been really, really rewarding for me.
That's fantastic. I couldn't agree more. I tell you what, Dr. Neumann, it's been so great speaking with you today. Thank you so much for taking the time to join us and share all this exciting information for our cat parents.
Thank you.
And if you'd like to learn more about Solensia, please visit solensia.com. And if you suspect that your cat might have feline OA pain after listening to Dr. Neumann explain the signs today, please do visit your veterinarian as soon as possible so you can get them back to living and loving life again. Meanwhile, I just want to thank you all for joining us. Your time is valuable. We appreciate it. And I hope you have a great day.